Good day, ladies and gentlemen. Welcome to our Health and Leadership Podcast, Episode 2, about cholesterol. And we have with us Dr. Robert Adams, retired Navy SEAL commander, retired Delta Force colonel, author of 3 books which are sold in over 14 countries, and super books. All right. So Dr. Bob is actually after the what should I say? Maybe he had trained some SEALs at the beach, so he's in a different kit today. So
yep, North Beach. There you go.
There you go. Right. So, Dr. Bob, how are you doing today? And we'll start with our first question. What is cholesterol?
That is a wonderful question, and the whole world is confused about the answer. Cholesterol is something that the body produces naturally in the liver to help us make some very important cellular products, including our hormones like estrogen and testosterone. We make those necessary chemicals for our body's health from cholesterol.
Yeah. Wow. Pretty good. So what are the main reasons people get elevated cholesterol? Has the definition of elevation changed?
Yes, the definition has changed routinely over the years because research keeps coming up with new ideas about the benefits or lack of benefits of cholesterol. You know, when you look at cholesterol numbers, most doctors will break it down into the high density and the low density cholesterol. High density cholesterol is good for you. It helps to prevent heart disease, whereas the low density cholesterol has traditionally been the kind that gets stuck in our heart vessels and has been suggested to cause heart disease. Now, I say suggested because the science is not very strong in support of that. If you don't have enough cholesterol in your diet, in order to answer your question, diet has the biggest effect on what your cholesterol numbers are. But I want to make a very important point here. Your cholesterol numbers don't necessarily correlate with your risk of heart disease. And the changes that you talked about are due to the fact that the people who sell us the drugs to lower our cholesterol have lowered and lowered and lowered what we call normal in order to sell more drugs.
Wow.
And unfortunately, we in the doctor world have been attacked and inundated by pharmaceutical companies that make these drugs so that we'll prescribe more medications to lower cholesterol. But honestly, if we lower it too low, your liver goes into overdrive and makes more because it wants you to have cholesterol. It wants you to have estrogen and progesterone. And so if you don't have enough, we'll make more. And we've had recent studies in the last 10 years that have shown if your cholesterol gets too low, then you die.
Wow.
So, there's a bottom limit too.
Wow, interesting insights, right? Excellent. So can cholesterol come via hereditary?
So absolutely. There are a number of inherited conditions, particularly in my own experience with patients that I've taken care of. Triglycerides. Triglycerides are what are produced when you eat more calories than your body needs. Basically, you eat whatever you eat, and there's calories there. If you've got more than you need, sugar, fat, carbohydrates, protein, doesn't matter. The body produces a triglyceride, sort of a carrying protein or sugar or fat that gets those excess calories stored into our body as fat. And it's easy to put into the cells, and it's really hard to get it out. Because if you think, our body is a survival expert, and it stores fat for future needs, and it ain't going to get back to you if you don't need it. So triglycerides can be so high that when you draw the blood, which should be red, it actually looks pink because there's that much fat floating around inside it. And I
My,
had a patient just like that. When I drew his blood, this layer of fat showed up on the top of the, or white, showed up on the top of the blood draw. And I went,
my,
oh my goodness. And where a normal triglyceride would be 150,
yeah,
his was 3,000.
3,000. Wow. Oh,
But this was genetic, this was inherited. And here's the interesting part of that story. His parents both had this same problem and they were doing very well in their 70s and 80s. So, he told me, he goes, I don't think I want to take a drug to
yeah.
lower a number that, makes my blood look funny if it's not going to hurt me. And I couldn't argue with him.
Wow. Pretty
Yeah.
interesting. So, do cod oil capsules help reduce cholesterol?
So fish oil
Yeah.
capsules, types the omega-3 fatty acids, lower triglycerides.
Yeah.
And my wife takes fish oil because her triglycerides have been high in the past.
Okay.
But it doesn't lower cholesterol, not the HDL or the LDL cholesterol, just the triglycerides. And the fun part about this discussion is we still have not proven that cholesterol in general or triglycerides in general are bad for you. We
Yeah.
identify, we attach numbers to them, but we don't know really if they're bad for you. Now, if you want to change numbers, the fish oil is a good way to change the numbers. And we studied fish oil. We started making fish oil because we noticed that people in Scandinavian countries that ate a lot of salmon high in these omega-3 fatty acids had lower levels of heart disease.
Yeah.
But we didn't correlate the fact that they also walk every day and live, in better environments and eat an overall healthier diet. So we can change numbers.
Yeah.
The question to ask yourself, is it necessary to change my numbers?
Absolutely. So, what are the other ways of lowering cholesterol? And do medications help or hurt?
That is my favorite question. And everybody, all my friends ask me the same thing. The best way to change your numbers is with good, healthy diet that has soluble fiber in it.
Okay.
And oatmeal is a soluble fiber. Most green vegetables have soluble fiber. Those can change your numbers in the right direction if changing your numbers is important. And we still don't know the answer to that question. But the medications can change your numbers, but the real question that has plagued doctors for close to 50 years is, if we change your numbers, will you live longer?
Yeah.
And this, what I'm about to say, is controversial, but it's very important. The people that are worried about their cholesterol, listen to what I'm about to tell you. The cholesterol drugs in general have only been able to show reduction in non-fatal cardiac events or heart events. Okay. Non-fatal. Well, wait a minute. What effect if I take this pill that costs me money and has side effects? What's the chances of it lowering my fatal events? Zero. No study has shown that if I give you a cholesterol medicine, I can reduce your fatal cardiac events by changing the numbers. What's interesting here is we have found an, oh, by the way, benefit of cholesterol medicines, because they have an additional ability to prevent platelets from sticking to each other, like aspirin. Aspirin does that. Aspirin prevent platelets sticking, so they prevent strokes and heart attacks. So nowadays, when we put a stent in your heart or we do open heart surgery, we give you a cholesterol medicine, not to lower your cholesterol, but to prevent the platelets from causing clots. And it works. But so does that.
Wow. Pretty interesting. So there are pros and cons, of taking.
There are pros and cons, and you need to be You need to educate yourself and decide whether the money that you spend and the side effects that you have to deal with are worth taking a medication that typically will not help you live one day longer.
Absolutely. So thank you very much for the clear explanations, Dr. Bob. And before we wrap up, I want you to give a message to all our viewers. And for those who don't know about Dr. Bob's books, there is one very good book about medical. It's called Swords and Saints, A Doctor's Journey, which is available on Amazon Kindle. So it comes with the blue cover, and there is somebody holding a sword. I'm not sure who's holding a sword, right? But right, it's a lovely book, easy to read. You will understand it, right? So it's very easy to read. Okay, so it's a wonderful book. So
And also available as an audiobook if you like to listen to books.
there you go. So if you're driving and you say, okay, I don't have time, I don't know this, that, you can listen to the audiobook as well, right? So any final message, Dr. Bob, to our viewers?
No, the final message is all medicines have side effects. The cholesterol medicines have significant side effects, including memory, muscle pain, joint pains, and weakness that, the benefit needs to be significant before you spend the money and deal with the side effects, as I would say about any medicine.
Yeah. Wow. Right. So thank you very much, Dr. Bob, for taking time and doing this podcast with us.
Absolutely. A pleasure once again, Michael.